I'm Dr. Ovais Zubair. I am a geriatrician with the Cox Health System. I completed my medicine from the Dow Medical College in Pakistan, and after that I came to the United States, did a 3-year residency in internal medicine at the St. Louis University, and then following that I did a 2-year fellowship in geriatric medicine. We basically, see older patients both in good health and the ones with multiple medical issues. We have outpatient practice, and we are one of the few physicians in the system now who are also continuing to see patients in the hospital. So even if our patients get sick, they get admitted to the hospitals, we ourselves generally go see patients in the hospital as well. Among all the branches of medicine, I think geriatrics is one of the most satisfying professional fields to be in. I enjoy working primarily with the adults in this particular age group. I find them to be some of the finest people that you will ever come across. What really is so great about an outpatient practice is that you get to develop long-term relationships with people over the years. I've practiced for over 20 years in the Cox Health System, and during that period of time I've had patients who have seen me for 20 years, and now their kids have become my patients, and I really enjoy that relationship that we have developed. And along with it, I'm glad that we still continue to do what's called the hospital practice, where we see patients in the hospital. That keeps you current with acute care medicine and hospital medicine, and most importantly, it gives me an opportunity to provide inpatient care to our patients when they're really sick and when they really need to have their primary care physician with them. When I was training and doing my internal medicine residency in the St. Louis University, I was greatly influenced by some of the professors over there in geriatrics. I did a few rotations, and again, I really enjoyed working with this particular population, and then I decided to go ahead and complete a fellowship, which took me another 2 years. So when I first came to Missouri, I liked the state of Missouri, and then when I was looking for opportunities to practice medicine, I interviewed at with the Cox system, and I was greatly impressed by the attention they'd been paying to geriatric care. And ever since I've been over here, the program has grown significantly, and a part of the reason is that we've had a good group of physicians, and Cox has been very supportive of geriatric medicine, something you don't see in the rest of the country at times. And also the people in this part of the country in Southwest Missouri, again, some of the finest you would ever come across, and I've really enjoyed working with this population. I enjoy watching sports. Sports is something I've really enjoyed all my life. Growing up in Pakistan, I was really into a sport called cricket, which I get to watch quite a lot these days. And over here I've picked up basketball. I really enjoy watching basketball. Still haven't figured out American football a whole lot. And then I like to travel, but lately haven't been able to do a whole lot.